So, hi everyone, let's start with the part 2 of the previous year question series. In this, I would be discussing the left questions of the PSM of the paper 2022. So, the first topic is various schemes. This is the very high yield topic if I talk about the PSM. Every year, 2 to 3 questions come from the schemes of the government. Let's talk the first scheme that is ICDS, means Integrated Child Development Services. In ICDS, let's see who all are the beneficiaries. If the child is less than 3 or 3 to 6 years, they are included in the ICDS services. And after that, the adolescent girls from 11 to 18, the women 15 to 45, the pregnant women, and after that, the nursing mothers. So the question they ask is what services are provided in the particular beneficiary group. If I talk about the pregnant woman, then what all things are needed by them? They need the health checkup, they need the immunization, they need supplementary nutrition, and the education towards the health and nutrition. If I talk about nursing, they again need the checkup, the nutrition, the education, but the immunization is not needed in the nursing mother age group. If I talk about the 15 to 14-year age group female who are not pregnant, so they just need the nutrition and health education. If the child is less than 3 years, he would be needing nutrition, immunization, checkup, and if pneumonia or diarrhea happen and if need for the hospitalization, the reference services are provided to them. If the child is between 3 to 6 years, all four things will be there. The additional thing would be added is non-formal education. And for the adolescent girls, they need nutrition program, Kishori Shakti Yojana, and the health education. So let's see what was and this was the logo of the ICDS. What was the question asked is that which of the following services are provided to pregnant women under the ICDS? They need checkup, yes. They need immunization, yes. They need nutrition, yes. Education, yes. So all four are correct. If I place instead of pregnant, I would have asked nursing mother, then immunization would not be there, health checkup, nutrition, and health education. So, according to the beneficiary, the answer changes. Next is Vande Mataram scheme. What is Vande Mataram scheme? It is a voluntary scheme जहाँ पे कोई भी obstetric या gynec specialist या maternity home or nursing home, any lady doctor or MBBS doctor can volunteer themselves that they will provide the safe motherhood service. The only condition is that the enrolled doctor in this has to display the Vande Mataram logo at the clinic. And what they are going to provide? They are going to give iron and folic acid tablets, oral pills, TT injection to the beneficiaries. But that iron folic acid TT would be provided to those doctors by the respective district medical officer. They will distribute the tablets and the injections to the doctor for free and they have to distribute this to beneficiaries. The doctor doesn't spend up any penny from their own pocket. They get these things from the district medical officer. And if the cases need any special care or treatment, need hospitalization or cesarean section, any kind of thing, then they can refer those patients to the government hospitals. So let's see what was the question. They asked the correct statements about the Vande Mataram scheme. Is a voluntary scheme? Yes. The enrolled doctor must provide iron folic acid tablet out of their pocket free to beneficiaries. That is wrong. The doctor doesn't spend any penny from their own pocket. They get these things from the district medical officers. So the TT injection are provided by district medical officer to enroll doctors? Yes. To join the Vande Mataram scheme, the facility must have resources for cesarean section? No. They just have to provide the safe motherhood services. Whereas the cesarean section, for that, they can refer those patients to government hospital. So 2 and 4 are wrong. So answer is 1 and 3 here. Next question is, this is the table showing the total fertility rate by the wealth index as per the National Family Health Survey. So, after looking this question, it seems very tough and typical. So, let's see what they are saying. They have provided the wealth index and the total fertility rate, and we have to rule out the options. Which one is the correct? Let's see the fourth one. Each of the higher division of the wealth index had lower TFR than the previous division. अगर लोएस्ट था तो टीएफआर था 3.17. जैसे जैसे वेल्थ इंडेक्स बढ़ रहा है तो टीएफआर कम हो रहा है. तो you don't need any extra knowledge for this topic. Question में ही आंसर छुपा, you just have to look at the question with a fresh mind and let's see कि each of the higher division पे TFR कम हो रहा है as compared to the previous. ये true है. Like आपको नहीं पता था कुछ भी but question में ही आंसर छुपा है. तो मीन्स फोर्थ स्टेटमेंट तो राइट है. बस हमें ये फाइंड करना है कि वन राइट है या रॉन्ग. तो वन में वो कह रहे हैं कि डिवीजन जो है एनएफएचएस 4 में क्या इसको क्वार्टाइल कह सकते हैं. नो. जो डिवीजन होता है वेल्थ इंडेक्स का दैट इज नोन एज क्विंटाइल्स, ना कि क्वार्टाइल्स. सो द फर्स्ट स्टेटमेंट इज रॉन्ग. द आंसर फॉर दिस इज ओनली 4. Next question is about the national framework for malaria elimination in India. इसमें क्या होता है कि गोल्स है. वी हैव टू गोल्स कि हमें मलेरिया को एलिमिनेट करना है बाय 2030 और एलिमिनेट होने के बाद वी हैव टू मेंटेन द मलेरिया फ्री स्टेटस इन एरिया जहां पे मलेरिया का ट्रांसमिशन इंटरप्ट हो चुका है सो दैट कि फिर से मलेरिया उस जगह पे री इंट्रोड्यूस ना हो. सो दो गोल्स है, मलेरिया को एलिमिनेट करना और मलेरिया फ्री स्टेटस मेंटेन रखना. ऑब्जेक्टिव्स क्या है? ऑब्जेक्टिव्स डिफाइंड है ईयर के अकॉर्डिंग. लाइक 2020 तक हमें जीरो इंडिजिनस केस करने हैं इन ऑल 26 स्टेट्स. फिर उसके 2 साल बाद 24 तक के हमें जो मलेरिया का इंसिडेंस है उसको लेस देन 1 केस कर देना है पर 1000 पॉपुलेशन. फिर 2027 तक जो इंडिजिनस ट्रांसमिशन है उसको इंटरप्ट करना है. And by the end of 2030, the malaria should be eliminated throughout the entire country. सबसे पहले हमने जीरो इंडिजिनस केस किए, फिर लेस देन 1 केस किया, फिर इंडिजिनस ट्रांसमिशन रोका एंड फिर एलिमिनेट किया. देन आता है कि स्टेट्स का क्लासिफिकेशन फॉर एलिमिनेशन. सो वी हैव 3 कैटेगरीज. कैटेगरी 0, 1, 2 एंड 3. तो कैटेगरी 0 होता है कि जीरो इंडिजिनस केस है. कैटेगरी 1 है कि लेस देन 1 है. कैटेगरी 2 है लेस देन 1 तो है एपीआई लेकिन कुछ डिस्ट्रिक्ट्स हैं जिसमें एपीआई मोर देन 1 रिपोर्ट हो रहा है. एंड कैटेगरी 3 मीन्स कि एपीआई मोर देन 1. Of the following statement regarding malaria elimination is true. The goal is to eliminate indigenous cases throughout the country by 2030. Yes, this is true. बाय 2022 ट्रांसमिशन जो है उसको इंटरप्ट करना है और जीरो तक लेके आना है. तो 2022 में जीरो इंडिजिनस केसेस दैट इज आल्सो ट्रू. 2026 में जो इंसिडेंस है मलेरिया का उसको लेस देन 1 करना है. लेस देन 1 जो इंसिडेंस है वो 2024 में करना है. सो दिस इज रॉन्ग. बाय 2030 इंडिजिनस ट्रांसमिशन जो है वो इंटरप्ट करना है. इंडिजिनस ट्रांसमिशन जो है 2027 में इंटरप्ट करना है. 2030 में तो एलिमिनेट करना है. So the answer for this is 1 and 2. Next topic is membrane filtration technique. Membrane filtration technique जो होता है इसमें क्या होता है? It's a standard procedure to test for the presence of coliform organism. And with the help of this technique, we can count the coliform colonies and obtain result within 20 hours as compared to the multiple tube technique which requires 72 to 96 hours. Means membrane filtration technique in the terms of time consumption better as compared to multiple tube technique. So let's see what was the question asked. That membrane filtration technique किस चीज में बेटर है मल्टीपल ट्यूब मेथड से. सो इट इज क्विकर एंड रिजल्ट कैन बी ऑब्टेन विद इन 20 hours. सो दिस इज द डिफरेंस बिटवीन द मेम्ब्रेन फिल्ट्रेशन एंड मल्टीपल ट्यूब टेक्निक in the terms of the time requirement. Next is about the unlined kacha wells. So let's see क्या होता है. There are two type of dug wells, कच्चा and पक्का. So क्या होता है कि जो unlined कच्चा wells होते हैं उनमें क्या होता है कि उनको उनकी सैनिटरी कैसे मेंटेन की जाती है. बाय डीपनिंग द बॉटम, इंस्टॉलिंग अ हैंड पंप विद स्क्रीन, filling the well with a coarse sand up to the water level and with the clay above that level. This is a very important line. And when the material used for filling is completely consolidated, a platform and drainage may be constructed. So these are the requirements for the unlined kacha well to maintain its sanitation. So what are the statements true for unlined kacha wells to maintain its sanitation? Deepening the water, yes. Filling the well with clay up to the water level and with coarse sand above that level, wrong. We have to fill the well with Coarse sand to the water level and with clay above that level. Installing a hand pump with a screen, yes. Constructing a platform and completely consolidated, yes. 1, 3, 4 are correct and second is wrong. Next topic we have is we have to see the definitions about eugenics, acculturation, euthenics and euphenics. So what is euthenics? Euthenics means throughout the course of history, man has been adapting environment to his genes more than adapting his genes to the environment. Is eugenics aims to improve the genetic endowment of human population. You just have to learn the definitions because they will give this whole paragraph and will ask what does that mean. So for eugenics, you need to improve the genetic endowment of human population. For euthenics, you shall adapt environment to his genes. For acculturation, culture contact, like two states में था कि दो culture का contact. So when there is contact between two people with different type of culture, this is known as acculturation. They have asked humans have been adapting environment to the genes more than adapting gene to the environment. We all know the answer is euthenics. Next is about the risk factors for coronary heart disease. We all know that the coronary heart disease are non-modifiable and modifiable. You all think by common sense, can we modify the age? No. Can we modify the sex? No. Can we change the family history? No. Genetic factors? No. Personality? Question mark. So these are the not modifiable. Cigarette smoking can be left, it can be modified. Blood pressure can be controlled. Cholesterol can be controlled. Diabetes, obesity, sedentary habits, and stress. These are the modifiable risk factors. So they have asked which of the following are modifiable? Age? No. Cigarette? Yes. Obesity? Yes. Sedentary habit? Yes. So the answer is 2, 3, and 4. Next is about the screening tools. So, alpha fetoprotein, it is used for the neural tube defect detection. In this, we measure a specific protein of fetal origin known as alpha fetoprotein in the maternal blood and in the amniotic fluid during pregnancy. So, they were asking that alpha fetoprotein level in maternal serum is a useful screening tool for. So, the answer is neural tube defect. Next question is we have to consider the phases of a family life cycle. You all know there are 6 phases. सबसे पहले फैमिली फॉर्म होगी. फॉर्मेशन किसको कहते हैं? मैरिज से लेके टू द बर्थ ऑफ फर्स्ट चाइल्ड. उसके बाद एक्सटेंड करेगी फ्रॉम द बर्थ ऑफ फर्स्ट टू द बर्थ ऑफ लास्ट चाइल्ड. फिर कंप्लीटली एक्सटेंड होगी कि लास्ट चाइल्ड के बर्थ से फर्स्ट चाइल्ड ने हैज लेफ्ट द होम. देन पूरे तरीके से एक्सटेंड होने के बाद द फैमिली विल स्टार्ट कॉन्ट्रैक्टिंग. सो कॉन्ट्रैक्शन के लिए द फर्स्ट चाइल्ड लीव्स होम टिल द लास्ट चाइल्ड लीव्स होम. Then complete contraction when we will say when the last child के left home से लेके first spouse dies and the end of the family is dissolution. In dissolution we have first spouse dies to the death of survivor. So these are the phases of a family life cycle. So we have to arrange the order. First we will form the family, then extend, then contract, and the last is dissolve. Next is about the severe measles. So all cases of severe measles should be treated with vitamin A. Why? Because many children develop the acute deficiency of vitamin A, which can lead to keratomalacia and blindness from corneal scarring. The recommended age-specific daily doses, we all know if the child is less than 6 months, then we should give 50,000 international unit, and between 6 months to 1 year, 1 lakh international unit. 1 year, we give 2 lakh international unit. So the question they asked was, which of the following vitamin is given in the case of severe measles? The answer is vitamin A. This question is about the end TB strategy. So end TB strategy का vision क्या है? The vision is that they want to see the world free of tuberculosis and there should be zero death, zero disease and zero suffering due to the tuberculosis. So this is the vision. Goal क्या है? कि global tuberculosis का epidemic को end करना है. So they have some milestones कि 2025 तक they have to reduce the TB death by 75%, incidence by 50%, and TB affected families facing catastrophic cost to zero. While the targets are to end TB and the TB by 2030, and the strategy envisions universal access to high quality TB care and goes beyond it to promote the TB prevention. And the end TB strategy identifies 4 barriers to achieving progress to fight against the TB. What are the four barriers? First is the weak health system. Second, underlying determinants of TB like poverty, undernutrition, migration, aging population, risk factors. Third, there are lack of the effective tools. And the last, continuous unmet funding needs. So let's see what was the question asked. The question asked was, what are the statements true about the NTB strategy? Goes beyond patient care to promote TB prevention? Yes. The targets are to be achieved by 2035? Yes. The milestone for 25 is to reduce TB death by 35? No. By 75%. And the strategy identifies four barriers? Yes. So the answer for this is 1, 3, and 4. Next question is about the tetanus toxoid. So we have three categories for the tetanus toxoid. First, unimmunized pregnant women, previously immunized pregnant women, and the third is infant born to the mother who have not previously received doses of tetanus. Unimmunized pregnant women, 2 doses of tetanus toxoid should be given, first as early as possible during pregnancy, and the second at least a month later and at least 3 weeks before delivery. If previously immunized pregnant women again get pregnant, then the booster dose is considered sufficient. And if the infant has born to the mother who have not previously received the 2 doses, in that case, we have to inject the antitoxin if it is administered within 6 hours of birth. So here they were asking to prevent the neonatal tetanus in an infant which has born to the mother who has not received the TT2 doses. In that case, we should inject the antitoxin serum within the 6 hours of birth. Question is about the hemophilia. So as we all know that hemophilia is a hereditary bleeding disorder. It has the equal incidence in all the ethnic group, and the disorder affects the male carried by females who are only occasionally affected and usually mildly. Means male is the disease of the males, females are just a carrier and they are very occasionally affected and usually mildly. And the foremost cause of death for hemophilia is the hemorrhage, especially in the skull. So there were the statements given regarding hemophilia, that it is a hereditary bleeding disorder. Yes. Higher incidence among Asians? No, it has the equal incidence in all the ethnic groups. It affects female occasionally and mildly. True. So the answer is 1 and 3. Next are about the screening program. What diseases you will consider for the screening test? The first is that disease should be an important health problem. Second, it should be a recognizable latent or early asymptomatic stage. Third, the natural history of the disease should be adequately understood. Fourth, tests that can detect the disease prior to the onset of signs and symptoms should be available. Facilities should be available for the confirmation of the diagnosis. There should be effective treatment available for that disease. And agreed on policy concerning whom to treat as patients should be there. Good evidence that early detection and treatment reduces morbidity and mortality. And last, the number of lives saved of early detection should exceed the risk and cost. So there were four statements given, and we have to choose what are the following criteria. Is the natural history of disease should be adequately understood? Yes. No effective treatment should exist for the disease. Obviously, Vata, it would be wrong. There should be effective treatment. The disease should not have a recognizable latent. अगर उसके पास asymptomatic stage नहीं होगी तो आपके screening का मतलब क्या है? So this is also wrong. There should be a test that can detect the disease prior to onset of sign system. Yes, so 1 and 4 are true in this case. Next question is, we have to evaluate the iron status. So for the evaluation of iron status, we have hemoglobin, serum iron concentration, serum ferritin, and the serum transferrin saturation. Hemoglobin concentration का इतना रोल नहीं है. In fact, serum iron concentration is better than the hemoglobin, and the value is 0.50 means probable iron deficiency. But the single most sensitive tool for evaluating the iron status is serum ferritin. So they have asked the single most sensitive tool. So we have serum ferritin. Next question is about the Kala-Azar. They are saying what should be the daily dose of the miltefosine in a 3-year-old child of weight. So according to the weight, they have divided the doses of the miltefosine. Like if the body weight is 9 to 11 kg, we will give 20 milligram. 12 to 16 kg में 30 milligram. 7 to 20 में 40 milligram. 21 to 25 से 50 milligram. Like हर 10 milligram increase करेंगे हम हर 5 kg weight gain पे. about the 15 kg. So 15 kg would be 30 milligrams. So the answer here is 30 milligrams. Next is about the RDA of thymine. This was the question which can be expected के नहीं आपको आएगा and आप याद भी करोगे तो भूल जाओगे. Like thymine में they are saying कि अगर if you have a sedentary work man तो sedentary moderate heavy तो डोज बढ़ेगा 1.2 से 1.4 1.4 से 1.7. अगर वुमेन की बात करें तो सेडेंट्री पे 1, मॉडरेट पे 1.1, हैवी पे 1.4 और अगर प्रेगनेंसी होगी तो प्लस 0.2, लैक्टेशन में 0.3 एंड 6 to 12 मंथ पे 0.2. So they were asking the RD of thymine in the moderate work of men. So it is 1.4 as we have just saw. So the next question is what should be the target population for screening of diabetes? So for the screening of diabetes, target population is first those are in the age group 40 and over, those who has the family history of diabetes, those who are obese, women who have had a baby weighing more than 4.5 kg, and women who show excess weight gain during pregnancy, and the last, patient with premature atherosclerosis. I have given three statements here. Women who had a baby more than 4.5, yes. More than 40-year age group, yes. Family history, yes. So the answer for this is 1, 2, and 3. Next question is about the swimming pool. The free residual chlorine should be. Here is the confusion. Confusion is कि जब भी हम क्लोरीन की बात करते हैं तो वी हैव द फ्री क्लोरीन वैल्यू 0.5 milligram per liter for 1 hour in a mind, but they were asking about the swimming pools. In swimming pool the value changes. For the swimming pool we have continuous maintenance of 1 milligram per liter of free residual chlorine. So the answer here in this question is not zero point 0.5. Answer is 1 milligram per liter. So if we ask that what should be the free residual chlorine minimum requirement, then the answer is 0.5. But in case of swimming pool, it is 1 milligram per liter. Second most common question asked in chlorination is that hypochlorous acid is the most effective form of chlorine and it is more effective than hypochlorite ion. Next, they can ask you about the orthotoluidine test and orthotoluidine arsenate test. So difference is कि orthotoluidine में हम free and combined chlorine देखते हैं, like arsenate में हम फ्री और कंबाइंड क्लोरीन को सेपरेटली देखते हैं. So this was the last question from the PSM. So we are done with the PSM previous year question of 2022 paper. Next video I would be taking up the medicine question. So if you have not subscribed the channel, it's time to subscribe. Please do not miss any of the upcoming video so that you do not miss on the any previous year question which is going to be repeat in your exam. So all the best, keep studying.